We want to speak now about a new order by the Supreme Court temporarily restoring access to the abortion pill. The U.S. Supreme Court is temporarily restoring full access to the abortion pill, keeping the medication widely available while challenges continue to play out in lower courts. It's part of a decision that came down yesterday, and it's already impacting people in places where access to reproductive care is already limited, like here in Georgia. Joining us now to break down what that means medically and from a public health perspective is Whitney Rice, assistant professor at Emory University's Rollins School of Public Health. She's also director of the Center for Reproductive Health Research in the Southeast, otherwise known as RISE. Thank you so much, Whitney, for joining us. We really appreciate it.
Thank you for having me.
Can you speak first about what this decision means and the impact it will have, especially here in Georgia?
Absolutely. So, this decision is about access to one medication used for abortion and one way of getting that medication. And the decision questions whether or not to place limits on mifepristone. So, mifepristone is one of two medications that are commonly used in medication abortion. This case is also specific to telehealth prescribed abortion pills, which people may receive via mail. They may be dispensed at a pharmacy. And telehealth has allowed for increased privacy, flexibility in appointment times, and more access to appointments for people who live far away from their nearest clinic, who have limited transportation or experience other barriers to in clinic care.
And how does this change access rights for patients right now, or is this more about restoring the status quo?
So prior to the lower court ruling, people were already able to access medication abortion via telehealth and had been for years. Right now, this pause restored that access as we await a Supreme Court decision. And I think it's important to note that I mentioned mifepristone is one of the medications used for medication abortion, but there is an alternative that is also used for medication abortion. And that is also safe and effective. I'll also note that there are community providers, online providers of medication abortion who may use one or the other regimen regardless of the outcome of this decision. But I think it's important to note that this decision affects the full scope of options available to people who are seeking an abortion.
For people who may not be familiar, can you walk us through how this abortion pill works?
So the pill, as I mentioned, is commonly one of the medication abortion regimens combines the use of mifepristone and misoprostol for people to take during pregnancy to have an abortion. There's also another regimen, a misoprostol only regimen that can also be used in a medication abortion. That misoprostol is not affected by this decision that we're awaiting, and mifepristone can still be obtained in clinic. It is obtained via telehealth currently, but we are awaiting this decision to understand more about what the full scope of options will be, if it will continue to be the current status quo or if that may change for people
From a
nationwide,
public,
actually.
yeah, good point. From a public health access point, what happens when this medication is limited or people don't have access to it?
So certainly, as I mentioned, telehealth has allowed for increased privacy, flexibility in people's ability to obtain an abortion, and access for people who live furthest away or have other constraints to accessing medication abortion. So limits placed on medication abortion may limit options for people who are, may have a preference for one or the other medication abortion regimen. We will still be able to access one of those medication abortion regimen, even if one is restricted in this way, and really both will continue to be available in clinic. This decision is affecting sort of which of those options is available and via what means.
And then when these medications are restricted, who is most impacted by those restrictions?
We certainly see that people who are facing greatest barriers navigating healthcare access generally, so people who are who have lower incomes, people who are greatest distance from available healthcare. We live in a state that, as many surrounding us, also are affected by healthcare deserts, and so and maternity care deserts. So we certainly see that this decision and others like it have certainly exacerbated some of those disparities in access to care for people in our state and surrounding states, certainly.
What should providers and patients really be paying attention to in the coming weeks?
I think in the coming weeks, certainly patients will be paying attention to what their options are, some of the same resources that sort of certainly providers might point patients to for where to access a medication abortion will be updating, if needed, their information about what options are available. We know that, again, some telehealth providers may choose to provide medication abortion via another regimen, or may have a limited options among the two regimens that I discussed. And in-clinic providers may see more patients coming to them for medication abortion if we see a decision that affects the ability to sort of telehealth prescribe medication abortion. So I think that is some of that is to be determined, but we'll certainly be looking at how this affects the full scope of care available to pregnant people and where and in what ways they may be able to still receive care. But I think some of the specifics will be what providers may update in terms of their guidance.
And lastly, for people who have questions about their care, where can they find safe and reliable information?
So certainly there are websites like ineedana.com that provide people with information about where to receive a medication abortion, as well as Plan C is another reliable site. And we have a number of wonderful clinics within our state of Georgia that also provide reliable information, including, Feminist Center for Reproductive Liberation, Emory University. Your providers can certainly direct you to important resources, but our independent abortion providers are really important resources for this information.
Thank you so much for joining us. We really appreciate your time and sharing this information with us. Thank you.
Thank you for having me.